Our next speaker, Maria Koulopoulou, is the clinical lead for pulmonary rehabilitation at King's College Hospital. Maria believes that sometimes you need to relearn how to breathe when you've got things like interstitial lung disease. So I'm delighted to welcome her here today to share some of her work and to tell us why movement matters. Maria.
Hello, everyone. Thank you very much for the invitation. I am delighted to undertake this talk, which I believe is very important to highlight an area in scleroderma that it may be a little bit underestimated how much the holistic care approach can really bring significant changes in the patient's symptom management and also quality of life. So as Sue gave the first introduction, my name is Maria. I'm the clinical lead for the Pulmonary Rehabilitation Program at King's College Hospital. And my experience in patients with scleroderma is when they are referred to our service, when the condition has impacted on, has affected their lungs, and they have developed interstitial lung disease. So why movement? I was given this title for the presentation, but I would like to say that this is a broader term: movement, exercise, physiotherapy, rehabilitation. So all these terms can interplay in the management of scleroderma in various ways. And all together, at the back of our mind, we need to think about holistic care approach and holistic care management for this condition. And as Professor Denton alluded, the new guidelines have given us a lot of insight about new management, new treatments, and new clinical pathways and improvements on the clinical pathways that we are managing these conditions. But my purpose today is to highlight what are the new updates regarding holistic care management in this disease, with a focus on exercise, rehabilitation, and movement, if you want to say that, or physical activity. So we have new clinical updates. One is the European clinical update about scleroderma, and the other, as very well extensively was described with new medications and new treatments, is from the British Rheumatoid Society, Rheumatology Society. Both of these guidelines have been updated concurrently, almost concurrently, and they are very fresh in the last year or so. The focus of these guidelines has been primarily in the internal organ management, with new medications that have come into play and ongoing treatments that we would love patients to take part and take part in clinical trials that are expected to improve eight domains, as it has been highlighted from 8 particular domains, as it has been highlighted from the European guidelines, which are focusing on the Raynaud's phenomenon, the digital ulcers, the pulmonary new drugs for the pulmonary arterial hypertension, the musculoskeletal component, skin fibrosis, interstitial lung disease, gastrointestinal component, and renal crisis. Across these 8 domains that have been highlighted from the European clinical guidelines, the recommendations focus primarily, as I said before, on the medication, which is brilliant, which is great. And all these areas, like the renal component, the interstitial lung disease, the musculoskeletal component, are important to be improved through medication. But in the priorities and the research agenda, although we know that exercise and holistic care approach can bring significant changes in the patient's management and symptoms, there isn't much emphasis there, and we need to think why. In the European recommendations, in the clinical agenda, it is highlighted, though, that it is important to gather information regarding the patient's reported symptoms. So we want to map and we want to know what matters for the patients. What are their symptoms, such as, for example, pain, dyspnea, fatigue. We do want to map all the symptoms, and we need to think also beyond the pharmaceutical and the drug component. Which other interventions can possibly improve these symptoms and the patient's quality of life? I found much more interesting the British Thoracic Society, the British Rheumatology Society guidelines, where the emphasis is the treatment should be offered to patients based on the elements of the disease that primarily concern the patient. And if we talk about, for example, interstitial lung disease, if the lungs have been affected, the British guidelines have shed light in the importance of patients to be referred to a pulmonary rehabilitation service. The patients have to think, we have to refer patients to a smoking cessation service. And we need to think, and we need to check their oxygen levels, of course, and see whether they need supportive treatment with oxygen therapy. The same with pulmonary hypertension. We need to review whether there is a need for oxygen support, and also referring patients for exercise, where there is some evidence that exercise can improve pulmonary hypertension in patients with scleroderma, systemic sclerosis. The musculoskeletal issues associated with the condition have been researched more than any other component of the disease, and there is more evidence in this area that any musculoskeletal problems associated with the condition can be improved by being referred to a specialist physiotherapist, which can deal with the problems. But we should be careful that the focus and the referral should not remain in the musculoskeletal, because the strength of evidence is higher there, and we overlook all the other components of the condition that are important to be treated and the patients to receive referral if required, including fatigue. Fatigue is the most highly reported symptom in the condition, but we do not have evidence as yet how to improve fatigue and whether exercise can improve fatigue. There is some anecdotal evidence, and there's some good evidence that exercise and gentle exercise and some particular movements can improve the component of fatigue, but we need maybe to work more towards this area to support treatments that are not highly evidence-based by personal experience, by being involved at something that there is some evidence but not strong enough. Oops. Sorry. And in terms of gastrointestinal problems, one of the reported symptoms is that it can also affect the bladder, and it is recommended that patients who may suffer from incontinence, they can have a good benefit by being referred to a specialist physiotherapy treatment. And also have anorectal biofeedback as training to improve the condition. So what I found also very interesting, and I would like to shed light here, and your advocacy as patients is also from us as healthcare clinicians, is important to understand the clinical pathway, the patient's journey when they are suspected, when they are suspected that they have the condition, and through the pathway of investigations and diagnosis, we have to make sure that there is no single patient that is lost from follow-up to be referred to the right services. So it is important, every single patient, to be aware of the pathway, not only the clinicians, but also the patients, and having the mapping of the clinical pathway, even though sometimes maybe the doctor may forget to refer you, it is important to know as patients your right to be referred to the right services and the benefit that you can get from the right service. So after a follow-up assessment, if it is established that you are diagnosed, for example, with a cardiac component, renal component, or lung component, it is within your rights to ask to be referred to rehabilitation services, well-established rehabilitation services, where these problems can be addressed and the symptoms associated with these components affected by the condition can improve a lot. As I said before, the musculoskeletal problems are quite one of the prominent symptoms in most of the cases, which can include tendinopathy, joint contractures, and in some cases they may progress to arthritis. So if this is the case, the mainstream referral pathway is standard physiotherapy, but also group therapy and group sessions and free exercise and movement, be involved in physical activity as much as you can. It is something that can improve the affected joints and improve the condition. But the more you also self-manage the problems associated with either localized arthritis or generic arthritis, the better you will maintain problems like joint stiffness, pain, or improving also the range of motion of the joints. Because this is a long-term, it's a chronic condition, you live with it, and it is not enough to have 3 or 4 physiotherapy sessions or 10 sessions, how much it is given to you, and stop there. So it is important to learn some movements and keep it as part of your life, to include that in your as a daily routine. The more you are engaging with physical activity and specialist exercises that have possibly been provided by your personal physiotherapists, it will improve the symptoms such as pain, fatigue. It will improve your quality of life. It will decrease the anxiety and the depression that is associated and interlinked with the pain and fatigue that is induced because of the joints have been affected. Okay. Quality of life can profoundly be improved by non-pharmacological treatments. And health-related quality of life is very much interlinked with how we function, how well is our physical component, our emotional component, and the social domains. Fatigue and anxiety and depression are again very predominantly reported symptoms, but this can be improved with exercise, and we want to promote that as much as we can, both from both sides, both from us, from our services as clinicians, to give access, to improve access to patients to exercise sessions, supervised exercise sessions, but also from your side as patients and as advocates for improving access to services. It is important to request development of more specialist exercise sessions and rehabilitation services for your condition. Unfortunately, in some cases, the condition can progress to palliation, and in this case, when the disease progressed to that stage, access to palliative care, it is also important. And things that can be addressed in a palliative care service is improvement, physical improvement, but also symptoms such as breathlessness and the emotional component also, as well as advanced care planning, can be improved through specialist palliative care services. There are some I don't know if any one of you has come across to any of these services, but they have improved a lot over the years. And palliative care, it is not only for end of life necessarily, but before someone reaches to that stage, they can help a lot patients who suffer from refractory breathlessness. They can help patients who suffer from ongoing pain and they cannot find support in any other service. So we need to explore and we need to work together how a specialist palliative care service can support patients with scleroderma who suffer from troublesome symptoms such as ongoing pain, breathlessness, and troublesome fatigue. Many of these services now, they offer specialist rehabilitation programs which are tailored to patients with conditions such as scleroderma, because they specialize in gentle exercise programs. They can tailor the programs to a patient's condition in a more holistic way. So they are not fragmented as we, unfortunately, with specializations now, with the specialist interventions that we offer to patients, quite often we fragment access to treatment, and patients can only be referred to specialist rheumatology physiotherapists or specialist pulmonary rehabilitation therapists. But in palliative care services, you may find a little bit of more holistic care approach and all the symptoms to be addressed, possibly more tailored to your condition. So it is something that also needs to be explored. What is the right service to support and embrace, tailor-based, a good rehabilitation treatment for this condition? Now, in the research recommendations, I was pleased to see that one of the areas that has been highlighted is stiffness of the joints and fatigue. Fatigue remains one of the symptoms that is not very well addressed. And we need to find more than one treatment to improve this symptom. And movement, exercise, and rehabilitation, it might be the one that will improve a lot this symptom. But we need to support you more for that. We need to give you access more to that. And you need also from your side to ask more access into into services that possibly offer specialist exercise programs to reduce fatigue. Now, in conclusion, movement may not be panacea for the disease, but it can improve significantly the symptom burden. It can alleviate the pain and breathlessness. It can reduce anxiety and depression, both biochemically, but also with socializing with other people who are in the same condition as you and have different elements of improving the symptom of anxiety and depression. It can improve specific symptoms such as joint stiffness and improve the range of motion of your joints. You are stakeholders, and we are also stakeholders of these services. And we need, from both sides, to advocate to improve access to non-pharmacological treatments such as physiotherapy, supervised exercise sessions, and palliative care. And closing this presentation, I would like to just spend 2 or 3 minutes to have a little go of some movements that you may have already experienced, or you may would like to experience just now to feel how it feels when you move your body. So, are you ready? You don't have to stand up. Where you are on your chair, I am not going to put you through any challenging exercises, just to feel the vibe of gentle movement on your body. So you can start where you are.
If you are comfortable, because we are in a great theatre, don't worry, I'm sure you can also do them sitting down.
Sitting down, yes, no, you don't have to stand on your feet.
You might get a bit exactly.
From a sitting position, it's just seated exercises. So just let's roll your shoulders. Good, and bring your shoulders up towards your ears and let it down. Bring it up and let it down. Good. Bring one of your arms in front of your chest. Stretch your arm. Bring it close to your chest, and then the other one. Now try to interlink your fingers in front of your chest and take a nice gentle breath in through your nose. And as you breathe out, tuck your head and lean towards your feet. And back towards your chest. And bring one of your arms if you feel that your shoulder allows you to lean to the side. Take a nice deep breath here. Breathe in and hold your breath. And lean to the other direction. And back. Bring your arms in front of your chest. Breathe in through your nose. Breathe out. Twist to the left. Exhale. Breathe in through your nose. And out. Okay. Arms behind your lower back. Breathe in through your nose and stretch the top of your chest. Up. And up. Give a little stretch on your fingers in front of you. And stretch the other one. And the opposite direction. Just be gentle here. If you feel that your fingers are stiff or it gives you pain, go to the range of motion where you're free of pain and go gently. And allow your arms to swing by your side. And give a nice stretch with a nice breath in over your head. And breathe. And once again. And thank you very much.